All right, so welcome back into the new or the continuous sessions of this lecture, introductions or basic introduction to pharmacology. All right, so in the previous times we look at the governing bodies of the drugs in the country, like Uganda. We looked at the functions or the roles played by those authorities, and that is to say, like their functions. All right, so we are to proceed from the national list of essential drugs, and essential drugs are basically those drugs that are easily accessible by the people, and most importantly, they satisfies the needs of the majority of the people or the majority of the population. Now when you get back, you can realize that there are some drugs that does not really demanded by the majority. They are needed or demanded by few people because they treat specific conditions or specific diseases compared to some drugs. So drugs that treats conditions like cancer, for example, they really do not satisfy the needs of the majority compared to drugs that treat common diseases like malaria, like candidiasis. Those could be some of the essential drugs that satisfies the health care needs of the majority of the population. Now, um, the National Drug Authority also have the role to play towards the essential drugs, ensuring that it is always revised on ensuring their quality, consistencies in their qualities, but most importantly, um, understanding essential drugs. So here we are saying that essential medicines are those drugs that satisfies the healthcare needs of the majority of the population, and it has some of the following characteristics. First of all, what makes it essential drug is that they are available all times. Now when you go to some of the government facilities, you're going to realize that some of the drugs are actually not there. Why? It is because they are not demanded and are not used by majority of the population. And then it's like when you are selling a product, and let's say people keep asking for binyewa, and you wouldn't bring a millet flour that nobody has ever asked for the whole year. You bring what is highly demanded, what satisfies the needs of your customers. So in this case, uh, the essential drugs should first of all be available at all time, and then the quantity should be actually available in large quantity in terms of the numbers of the drugs, the like of treatments for malaria, and then the quality should be considered, the forms of the doses, and then the affordability. You take notes of those characteristics. Now when we are to say that cetrimixazole qualifies to be an essential drugs, it should have gone through certain criteria or determinations of some factors that could make it exactly what we are calling essential drugs. Now the selections should regard to the following. Number one, the prevalences of the disease that 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 particular drug treated. Now, for instance, when you talk about prevalency, we are referring to existing cases of certain diseases. Now, when you look at the like of cholera, and then you compare cholera with malaria, you're going to realize that malaria is very common compared to cholera. When you go to the hospital, you're going to find so many numbers of people that have been admitted with cases of malaria. Now, those are prevalent cases. The case is a case of a disease that is already in existence. Compared to cholera, you might not even find a single person that has been admitted with cholera. Now, the selections should be based on the prevalences, how often people get sick of certain disease. So first of all, now that is creating demand for that particular drug. Now, two, if evidence on efficacy. Now, how effective is that drug to be used? Because certain drugs, they don't even work alone. They need to be accompanied with certain drugs for them to work. Now, if we can treat our patients with a certain drug, and then at the end of the day, our patients does not cure or don't get any help after using the resources in the name of drugs, then it makes it meaningless. So we need to look at how effective, without it being wasted after using it, without giving any proficient results. Now, there is also evidence of safety. The safety of that particular drugs. Uh, how good is it when people use it? How effective could it be? Comparative cost effectiveness. The cost effectiveness, this look at the affordability, and they must meet the needs of the majority of the populations. That should be looked at in within the criteria. I mean, procedures under which certain drugs can be approved to be essential drugs. Now, sufficient proven scientific data regarding effectiveness must be available. How good they said that particular drugs is should not be a rumor, should not be something known to a particular person, but should be available whereby people could access the information about it. And then substantial safety and risk benefit ratio. Now, when you talk about the risk benefit ratio, we are referring to the fact that there is no drug which has no effect, or you get there's no drug which has no effect. But if the benefits outweigh the risk or the demerits of it, that means such a drug can be used. So you might take a tablet, you might take a treatment that gives you headache at the end of the day, gives you makes you vomit, gives you light in head, but we still recommend. Why? Because when you look at the side effects of it, it's not as harmful or as worse as what disease can do to you. You get that? So that is risk benefit ratio. That means you're risking something, you're actually taking it knowing that you're going to have headache, but you can't compare the damage that disease can bring to your organ, for example, like your liver. So you're going to take it. It's like food that we eat. Sometimes we eat poisonous food, not because, as long as you understand that the level of the poison cannot harm you, but the most important thing is that you obtain what you should. So the safety of the risk benefit ratio. All right. So it's like something you're risking 2 out of 10. You get it? So you're gaining 10, then you're losing 2. It's a good risk. And then the quality, the quality, how good it is, should be tested on continuous basis, such that the efficiency and the quality is being maintained, and if possible being improved. Now, the next thing also is that should contain single pharmacologically active ingredients. What is made or is used to make that particular drugs? it has to be a very active ingredient or content. Combination products, as an exceptions, will be included where patient compliance becomes an important factor, or when two pharmacologically active ingredients are statistically active in a products. So in most cases, some of the patients may not be able to respond to certain drugs, particular drugs. Now, as a result, when in production stage, the ingredients cannot be every ingredient cannot be packed into one drug. Now, it's a reason why when some people could be using paracetamol as a painkiller, others could be using ibuprofen, others could be using diclo. So all those because the green ingredient has been scattered so that the needs of different people can be met based on the condition that is highly expected. Now, there's what we call rational use of drugs, which means a patient receiving medicines which is appropriate to their needs, clinical needs. If I need so the rational use of drugs or medicine emphasizes on ensuring that patients get what they deserve in order to satisfy the needs for their treatment. Now, let's look at a patient getting the right dose for their treatment and also at affordable cost. This one can happen. For example, you may walk into a pharmacy and then your treatment should be given for a period of 3 months. Sorry, 3 days or 5 days. And then it takes 5 days for you to get that condition rage, but then you will end up being given a treatment for 2 days instead of three, or 3 days instead of five. That is already under treatment. Now, that means, first of all, you're not going to get help or get your condition treated. So definitely, that's going to be insufficient and you're going to be affected. Now, sometimes the drugs may be given to you in a full dose, but the costs may be too high that a patient may not be able to afford, and that can lead to a further complication or even death as a result of the costs. Now, the rational use of drugs looks at the interests and also what is being protected. Now, we have the two categories of rational use of medicines. We have mostly what is protected is what we are referring to as irrational. Irrational. Now, when the drug has been used rationally, means patients has been given the right medicine that matches with the clinical problems, the right doses given within the right period of time at a very affordable cost. That means everything is perfect. But in scenarios where things happen to go wrong, and that's what we are calling irrational use of medicines. Now, this involves the following. When too many drugs are given to a patient, you're having a certain program and they give you like 5 different types of drugs, it is irrational. And then wrong choice of drugs for a particular condition, wrong choice. A clinicians could give you a certain drug that might not match so well with the condition. It may help, but they have a very incompatible ingredient which does not match in fighting that particular condition. Therefore, it means it will require a long use of that drug before your problem can be solved. So wrong choice in choosing the right treatment or drug for particular conditions, and then inadequate doses. This is like you're supposed to get the treatment for 5 days and then you're given for 2 days. It's already inadequate. Or maybe you're supposed to take one, let's say 3 times a day, and you're asked to take 1 time a day or two. That is already underdose, and which equivalent to inadequate. And then unnecessary use of injections, where sometimes drugs or tablets can work. Sometimes these people can just say that you have to go for injection, and yet your condition can be treated with tablet. Let's say you have flu, just a minor flu, and they say you're going to get injection for 5 days. That is rational. Right, that was a quite of in disruptions right there. So let's proceed. All right. We okay. All right. So we talked about unnecessary use of injections where oral doses form can be applicable. It states where a tablet can work for you, but then they suggest that you should go for injections. That's irrational use of medicines. Then we are having indiscriminate use of antibiotics in the treatment of viral infections such as cough, diarrhea, among others. Particularly treatments or conditions should matches with their best treatment that can work better. Now, this one is quite similar with the wrong choice of drug for a particular condition. Okay, so what are the factors that contribute to those irrational uses? One is heavy patient load. When patients are too many and we have few personnel who are dealing with them, it causes some of those errors. Two, poor communication skills among healthcare providers. Now, the healthcare providers may be getting wrong, let's say having lengthy distance between them as far as a gap in the communication. So you realize that the patient has already been treated as again being re-given a treatment because there is no formal communication, no documentation showing that. Now, it end up patients getting double treatment. Now, that results into overdosing a patient. And also, it states all scenarios where a patient even sometimes may give the doctor or the facility a wrong information. Now, when you give a wrong information, your health and your treatments are determined based on the information you give. So that may also result into rational use of medicine. Now, we come into lack of ethics among healthcare providers. Ethics is what judge give us directiveness to judge between right and wrong, and deals with the principles and the studies of applications of how things are supposed to be done. Now, when there is lack of that, people could really be acting unprofessionally, because they neglect some of the roles, they don't investigate enough or deeply, then they go ahead and provide treatments which may actually lead into some of those conditions and challenges. So please, I quite believe that some of this could really be delineated, they can be understood. So I'm going to resume and talk about classification of drugs.